If you feel like an elephant is sitting on your chest, you might have just 60 minutes to save your life. Hi, I'm Golsa, second year cardiology resident. This is Cardiomagazine. Welcome. Let's break down 7 top causes of chest pain. Okay, first things first, when you need to call an ambulance or see a doctor. If your pain is new, you never felt before. If your pain is severe, you can't handle it. It doesn't matter if it's in front of your chest or in the back. If your pain is very severe, you need to see a doctor right now. If your pain is along with shortness of breath, this is a very important sign. If your pain gets worse with walking or climbing upstairs, any activities. If your pain lasts more than a few minutes, that could be an important kind of pain, so you need to see a doctor. Let's talk about top 3 killers. Number 1, heart attack. It's pressure squeezing heaviness in the center of your chest, which spreads to the back, the jaw, and arm, usually left arm. It's along with shortness of breath, nausea, and it gets worse with walking and physical activities. Women under 55 are 2 times more likely to feel atypical symptoms like just nausea or back pain. The second one is aortic dissection. It feels like being stabbed in the back. It's very severe pain and you cannot ignore. The survival rate reduces 1% per hour. This is very emergent condition. You need to call an ambulance right now. The next one is pulmonary embolism. It's kind of chest pain with shortness of breath, and it can be with coughing blood. This is the third one of emergent condition. If you feel such pain, you need to call an ambulance. So let's talk about the sneaky mimics, which pain is awful but it's not dangerous. Number 1, the most common non-cardiac chest pains is related to digestive problems like acid reflux. Acid reflux feels like a burning pain behind your breastbones, and it gets worse with lying down, having a meal like spicy or fatty meal. The next one is esophageal spasm. Esophageal spasm feels like a squeezing pain. It can mimic heart attack. Number 2, muscle and bone pain. Costochondritis is a sharp pain when pressing on ribs. It can be better with resting and painkillers. It can be pulled muscle. It's a soreness that gets worse with moving or taking a deep breath. The next one is panic attack, anxiety and stress. It feels like chest tightness, racing heart, and dizziness. The chest pain of panic attack can last for hours. But if you are a doctor or health worker, you need to rule out other causes of chest pain because others are more important. The last but not least cause of chest pain is one even doctors can miss it: shingles. Shingles can cause burning chest pains before even rash appears. So, if you're having burning chest pain, which is one-sided with tingling, think about shingles. So, this is it. Drop a comment if you've ever experienced chest pain. How did you handle it? Please like and subscribe. See you next time on Cardio Magazine.